So, my name is Amanda Hall. I'm the Senior Director of National Campaigns here at DreamDotOrg. So, now we're going to talk about the modern era. In the 1990s and early 2000s, we start to see meth really go mainstream, really targeted in rural communities. DARE programs, I'm sure folks remember those pretty well in school. It was just continuing abstinence only education, continued war on drugs kind of tactics. Up those penalties, continuing to criminalize. We also see a new wave of the way that we stigmatize and showcase folks that use drugs. Early 2000s, the late 2000s, even a little before that, we really saw the prescription opioid crisis start to uptake. So pharmaceutical companies saw a reduction in laws related to pain management and then aggressively marketed opioids like Oxycontin. At the same time, though, we saw these pills start to really permeate in the white community. And we saw a reversal from what we saw in the 80s, whenever it was primarily Black communities, communities of color. We actually started to see, as the opioid crisis expanded, we start to see kind of a reversal. We start to see talking about treatment, looking at alternatives to incarceration, looking at things of that nature. So it really shines a light on, again, the racism embedded in the war on drugs. We saw a lot of big pharma companies get a lot richer. Okay, and then we saw these crackdowns on opioid prescriptions. We saw things like Casper coming up in different states where a lot of folks would go to different doctors to get prescriptions, me included. I had a substance use disorder and I needed that to function. So we saw that cracking down. And instead of really prosecuting or going against big pharma, often those people, those folks with substance use disorder would pay those prices. But we also saw, as prescription opioids started to decrease, people were still addicted to these substances. So we saw them turning to things like heroin. And then we really started to see fentanyl. Now, fentanyl has been around for a long time. You know, fentanyl is used in the hospital setting. It's actually a tool to effectively help with pain. But what happened is this started flooding the streets. We saw things like carfentanil, which definitely these types of drugs can be deadly. And again, the way we dealt with it and the way we're dealing with it now is increased penalties. We are starting to see a rise in criminalization, see longer sentencing for fentanyl-related offenses. And it really looks like we are repeating the past. So again, we are in that widespread fentanyl crisis. The increased criminalization is coming back. In the last 2 years, over 30 states have introduced drug-induced homicide bills. Those were bills we saw back in the 80s. That's where those really started and grew popularity, and it kind of been quiet for a while, and now they're popping up in states everywhere. But also, it's when we're starting to finally see some public health initiatives. It's when we're starting to see more prevalence. Naloxone, Narcan. I have to tell you all, Narcan was FDA approved in 1971. There is no reason that in the last few years that we should just be getting this into our communities.